Next, a clinical, Alex Ruskoff from PATH is going to share the oxygen needs tracker. Go ahead, Alex.
Thank you very much, Tom, and thank you very much, Tom and Leith, for inviting us to present our tool, the Oxygen Needs Tracker. My name is Alex Rothkopf. I'm representing PATH. I work with PATH as a data science and supply chain advisor, and co-lead a Gates investment that is supposed to coordinate respiratory care, coordinate efforts under COVID-19 together with CHAI and the EBC. So late last year, CHAI, the Air Breath Counts Coalition, and us, we noticed that there is just not enough awareness around how much oxygen is actually needed and how much investment is needed to make oxygen available in low and middle income countries. And that's where we started to think about how we could create a data-driven advocacy tool that allows people to understand even how much is necessary in terms of oxygen in cubic meters or cylinders, and how much investment that will ensue. And that's where the Oxygen Needs Tracker came along, which is exactly doing that. It's telling you how much cubic meters of oxygen a country needs under COVID-19 infection rates, and also provides a global estimate of cost. Now, how do we get to these numbers? That's my first slide. Next slide, please. So we get there by starting with the daily COVID-19 cases that are reported out of low and middle income countries. And we're using a estimation methodology that was put forth by the WHO in the beginning of the pandemic that has an estimator for how many people require oxygen treatment, how many of those are severe and critical cases that require a specific volume of oxygen in liters per minute, and over what kind of estimated average time they are treated. Knowing all of that, it allows us to estimate the overall cubic meter or large cylinders daily oxygen need in each country that reports COVID cases. So this is the first step. It gives you essentially the need. And then as a second step, what we also wanted to give decision makers, advocates as a tool is what's the, in our case, annual cost to satisfy that need. And that's a particularly complex endeavor. What we did is we created a tiered methodology to distinguish by income level the investment gap, create an assumed device split or modality split between different manufacturing and distribution methods, which is PSA plants, liquid oxygen tanks, cylinders, and concentrators, and between the experience that PATH and CHAI has in many countries across the world. We created blended cost metrics for each modality to estimate the cost to deliver that oxygen and assume that the current state of oxygen need from the tracker is maintained over an entire year, which results then in the annual cost. And the outcome of all of these activities is the Oxygen Needs Tracker, which I'm posting into the chat now. Hopefully that works. Yep. For your perusal. Next slide, please. I brought I copy pasted it from yesterday, where it presents the overall need across the entire set of lower middle income countries as about 26 million cubic meters per day, and the associated estimate to fill the gap of around $6 billion US. So it provides you with an opportunity to look at the current state of infection and turn that into an oxygen need and a estimate for a global investment. So you could dig down into the countries by clicking on the orange circle and then choosing a country that you're interested in to estimate the cubic meters. We're not providing a cost estimate per country currently because of the complexities of estimating cost on a country by country basis. It varies a lot. So here you have a really data-driven tool that allows you to advocate for oxygen need on a country-by-country basis or on the globe. What I wanted to highlight is how it depends on the COVID-19 infections, because that's our baseline driver. If we go to the next slide, I'm looking at the cost estimate that the tool would have provided since the beginning of the pandemic in January. You see that the cost estimate goes is proportional to the cases reported. But since about mid last year has been consistently above $1.5 billion as of an investment, and the recent spike, particularly through the India crisis, has pushed this up to an investment of around $6 billion, speaking to the tremendous need of oxygen investments that we require to actually respond, and only to COVID. This needs assessment that we're doing here in a very rough form doesn't even cover any baseline needs that might be there in countries in addition to the COVID response. This brings me to a point that I wanted to highlight here about using this tracker not only as an advocacy tool, but maybe also as as an early warning system. If we go to the next slide, because what we see over the last, say, 1.5 years of response is that we are very reactive to surges. So if you look back, and I'm presenting here data for oxygen need in India on the left-hand side, and for Nepal, because it's front of mind for many people these days. If you look at the oxygen need here, you always see the same story. There is a decline in cases and therefore in need. And that decline, or the relaxation phase, should be used to prepare, right? It would give us an opportunity for some time to prepare the system against the next surge. Then there is what I would call an uptake phase. I denoted that in blue, and you see that the uptake phase is only a short period compared to the longer period of relaxation, depending on where you start or where you end. Could be, in these cases, something between 3 to 4 months. And then you have like an uptake phase where you start to see more cases. This is the early warning signal where it's not exploding yet, but where we know something is going to happen, where we need to start to execute on our plans, where you need to start to intervene already with public health measures. And then there is this red phase that we know all too well that we see in India and Nepal right now, where it's a distress phase, where we just really cannot respond anymore. And the reason I'm bringing this up is that we're still working too much as a reaction to a distress phase that we see through media, that we see in the data, but we're not really trying to be proactive in using this relaxation phase that can go for quite a while, here shown in green, to prepare appropriately. And the reason that is particularly important for oxygen compared to other disaster responses is that oxygen is very, very complex. And that is, like, tying back to Ali's presentation, you saw already how complex it is to build up an oxygen system, how many different pieces need to come together beyond just procuring, and even procuring is a difficult task, to actually bring oxygen into the lungs of a patient. It's by far more than a 2 to 4 weeks window that is shown here in blue, not even speaking about a few days of a response that we may know about from other disaster response settings, where we can just ship in water, food, blankets, tents. That's not the same as oxygen, which takes weeks and months to procure, deliver, install, and get ready to use. So this tracker has also the ability to give you, if you're following it closely, country by country, the ability to use that relaxation phase and use that to advocate for investments now, while there's nothing happening, and identify or detect an uptake phase to execute on these plans. Yeah, so this piece here will tie to Jason's presentation in a few minutes around how complex it is to actually bring all these pieces together. Thank you very much.
Thank you so much, Alex. I know a lot of questions will come up during the panel here at the end.